You are listening to The Summit FM. I'm Brad Savage, and it is time for our Summit Focus Community Spotlight. The Summit FM, speaking with Crystal Clinic Orthopedic Center, a physician-owned hospital system. And today, Dr. Eric Neumann joins us, and he has some great background. He'll be talking in particular about spinal stenosis today, a specialty for him. But Dr. Neumann, thank you. Thanks for joining us today.
Yeah, thanks for having me on, Brad. Pleasure to be here.
I understand a fairly common condition in older adults is spinal stenosis. So tell us a little bit about that. What are some of the symptoms?
Sure. So spinal stenosis is a term that is used to characterize narrowing of the spinal canal, particularly in the lumbar spine. So our spinal canals are a cylinder of bone that the nerves run through. And just like a pipe can get corrosion with time, our spinal canals get narrower as we age. Multifactorial from disc bulges, ligament thickening, arthritis of our facet joints in our back. And what this does is narrow the room available for the nerves. Mm-hmm. The typical symptoms end up being usually buttock and thigh pain that is worse with standing than sitting. And also many patients report that walking can exacerbate their symptoms. A lot of people will come to my clinic and say that they feel like their legs are getting out when they've walked a certain distance.
Okay. Now, so now that we know the symptoms a little bit, what are some non-operative treatments that you might have?
Sure, and I think everyone should start in this category of trying to avoid surgery. So there's a few things that we can do. Once the diagnosis is made with history and physical and also seen on MRI, what we like to do is start patients out with medical management and physical therapy. There are certain medications that can help with nerve pain, and physical therapists can show our patients different exercises for their low back and stretching in order to sort of just maximize their function. I would say that the next step in treatment or invasiveness would be an injection for these symptoms. We typically have our interventional radiologist or pain medicine doctors can do a steroid shot under x-ray guidance in order to target some steroid at the level where the nerves are being pinched. This helps calm down the inflammation in that area.
Now, what about those instances where it looks like an operative treatment is going to be required? What does that kind of look like?
Yeah, so, with some of these non-operative modalities, they can become less effective with time, and patients may opt for surgical treatment. Surgical treatment usually involves an operation on the lower back that we go down to the bone. We make a small cut in the back of the bone, which is called a laminectomy. And what it does is it turns the spinal canal from a O into a U, where you're basically removing the roof of the spinal canal.
Okay.
By doing that, the nerves are able to drift backwards and have more space, and the typical symptoms, as we discussed earlier, improve. So this can sometimes be a same-day surgery, depending on the patient's health or the number of levels that need to be addressed, but patients usually do pretty well with this procedure.
Excellent. Well, if you're just joining us, it's the Summit Focus, and we're talking with Crystal Clinic Orthopedic Center and Dr. Eric Neumann, a spine surgeon. So, yeah, if you do end up with that operative, surgical treatment, what does the post-surgery recovery kind of look like after one of these procedures?
Yeah, so we like to get our patients moving with physical therapy right away. So even whether it's a same-day surgery or a one-night admission, we have our therapists see our patients as soon as they're awake and alert after surgery. We get them walking up and down the hallways and trying to get some of their strength back. We typically want the patient to keep the wound clean and dry for the first 2 weeks, bring them into the office to check how they're healing. And then somewhere around the 6-week mark, we get them into more aggressive therapy in order to start strengthening, more mobilization, and usually somewhere between 6 weeks and 12 weeks, most patients have made a full recovery and are getting back to their normal activities of daily living.
Excellent, excellent. Well, Dr. Neumann, we thank you for joining us today and kind of giving us that background. And you said you're pretty new to Crystal Clinic, is that right?
Yep, I just recently finished my fellowship August 1st. So, like I said, I started at Crystal Clinic just this past month, and
yep.
I have openings, and I'm eager to help the people of Summit County.
Well, you can find more if you go through Visit Crystal Clinic. If you just go to crystalclinic.com, that is, and you can now schedule an appointment online 24/7 as well. And Dr. Eric Neumann, thank you. Thanks so much for sharing the information, and congrats on your new position.
Yeah, thank you, Brad. Thanks for having me on the show, and I appreciate your time.